Hello, welcome to my channel. So today we'll continue with the cardiovascular system, but specifically we're going to do the circle anatomy of the circle of Willis. So meaning this is just a short video where we talk about the circle of Willis, as in the anatomical part of the circle of Willis and clinical significance. So this will go through even some clinical significance apart from the anatomy. Okay, wondering why it is called the circle of Willis. It's just a circulatory anastomosis that supplies blood to the brain and surrounding structures. That's actually the function. Okay. It is named after Thomas Willis, who of course from the 1621 to 1675, an English physician. Okay. The brain receives its arterial supply from this cerebral arterial cycle. Okay, which is of course called Willis. It is called Willis' cycle, loop of Willis, cerebral arterial cycle, Willis polygon. It has a lot of names, but specifically in this lecture we're going to refer to it as cycle of Willis. This is the cycle of Willis. So now let's just see how it develops. Okay, anatomical position. It is located at the base of the brain around the optic chiasma and the hypothalamus. So this is actually where it's located, and you pass and go this side. Okay, that's the anatomical. Then in terms of formation, it forms, so the aorta are going to give off the following branches. Okay, number one would be the right subclavian artery, which in turn gives right common carotid and right vertebral arteries, whilst the left subclavian artery gives off the left vertebral arteries. Then you have the left common carotid artery, and there are two systems participating in the formation of the circle Willis. So in short, we have the vertebral system and the carotid system. These are the two systems which participate in the formation of circle Willis. Okay, start with the vertebral system. The vertebral system, we have the left and the right vertebral arteries that arise from the subclavian arteries and form the basilar arteries. Then the basilar arteries give the following branches. Number one, we have the posterior cerebral artery, which supplies oxygenated blood to the posterior aspect of the brain, which is the occipital lobe. Then we have the superior cerebral artery, which supplies the superior half of the cerebellum and the parts of the midbrain, and it is not necessarily part of the circle of Willis. Okay, that's the vertebral system. Then let's go to the carotid system. So the carotid system, or the internal carotid system, the internal carotid artery mainly supplies the anterior aspect of the brain. That's why it is also known as the anterior system. So it gives the following branches. Number one, of the anterior cerebral arteries. Then the anterior cerebral arteries form the anterolateral portion of the circle of Willis. Then the anterior cerebral arteries also supplies a part of the frontal lobe, specifically its medial surface and the upper border. It also supplies the front 4/5 of the corpus callosum. Okay, then the middle cerebral artery, it does not contribute to the circle of Willis. So to get now, let's continue with the carotid artery. So it also gives off the posterior communicating artery, which connects the internal carotid arteries to the posterior circulation via the posterior cerebral arteries. And the left and the right anterior cerebral arteries are connected by the anterior communicating artery. So now let's now see what we're talking about. Okay, so we're talking about how the arteries are going to come in. Okay, so we have the vertebral artery this side. Okay, then you have the carotid artery this side. Okay, of the internal carotid artery, of the medial carotid artery. Okay, then you have the ophthalmic artery, You have the anterior cerebral artery this side, then you have the anterior communicating artery on the middle. Okay, then they're going to branch off, then we're going to find the anterior choroidal artery, and this is the posterior communicating artery. And this is the posterior cerebral artery, the superior cerebral artery. Then here we have the pontine arteries, and in the middle that's a basilar artery. Okay, which is of course affected in locked-in syndrome. Then we have the anterior inferior cerebral artery. We have the lateral-pontine syndrome. If it's affected, then we're going to have the lateral-pontine syndrome. Then we're going to have the posterior inferior cerebral artery. We have the lateral-medullary Wallenberg syndrome. So in short, this one usually comes for you to actually draw the circle of Willis. So it's a must. You definitely need to know how to draw the circle of Willis. So definitely you have to know how to draw this. Okay, so let's continue. So some clinical significance. So we know that stroke, it is the interruption of so number one clinical significance is in a stroke, which is the interruption of blood flow in the brain, and it is of two types. We have ischemic stroke and hemorrhagic stroke. So ischemic stroke is dangerous because the presence of the plaque in the internal carotid artery can lead to the formation of a thrombus or emboli, which travels to the circle of Willis and can obstruct blood flow, causing an ischemic stroke. Whilst hemorrhagic stroke can occur because of an aneurysm that grows and ruptures at a certain point, which can cause hemorrhage and ultimately a stroke. The aneurysms are commonly formed at the division points of arteries, as division points are considered as weak spots in a circulation. So this is the clinical significance, and it's very common in stroke. And the other clinical significance is the subclavian still syndrome, but otherwise the one which is very common is the stroke. And otherwise that's the end of the tutorial. This was more of the anatomy of the circle of Willis and the picture now to necessarily draw the same circle of Willis. Okay, so if you haven't subscribed, please subscribe and hit the bell notification, and see you on the next tutorial.